there are 43 of you. You have to understand that I have a Google extension here. The moment that you have logged in, it automatically logs in also your participation in this class. Yes, please, whoever that is, please mute yourself so that I cannot hear whatever is going on in your environment. Yes. Kasi meron pang dumadaan na tricycle, mga ganyan. Okay. Can you please mute yourselves for the meantime until I say that you can open your mics? Yes. Okay. So I have 29 participants here, and there are 43 of you. First one on the list is Miss Mortalia. Where are you?
Present, ma'am.
Okay, Miss Oliver. Hello. Where is Miss Oliver? Miss Oliver, are you there? Can you please turn on your mic? Hello? Asan na siya?
Hindi ko ma-on yung mic ko.
Hindi, okay na. Naririnig ka namin.
Ay, okay po.
Mr. Novales, where are you? Yes, okay. Next we
Present,
have
ma'am.
Miss Vanzan. Okay.
Present, ma'am.
Miss, Mr. Ocampo, where are you?
Present, ma'am.
Okay. And then we have Miss Millares. Miss Millares, where are you?
Present.
Okay. And then we have Miss Makusi.
Present po.
Okay, Miss Makusi. Miss Maramag. Is this Mr. or Miss? Miss, tama?
Miss, ma'am.
Miss.
Present,
Okay.
ma'am.
Hello, Miss Maramag. Yes, we also have Miss Mostrales. Where are you? Okay, Miss Mostrales. Miss Viloria.
Present, ma'am.
Miss Viray. Miss Viray, where are you? Miss Viray? Saan ka? Where are you, Miss Viray? Oh, okay. Please turn on your camera. Okay. Next, also, Mr. Vidal. Where are you, Mr. Vidal? Miss Nobal. Where are you, Miss Nobal? Miss Nobal. Mr. Montemayor, can you please mute your mic? It's rather loud. Okay. Thank you so much. Miss Nobal, where are you? Hello? Yes, you're not around. Mr. Shazon, later, we're going to talk about that for a while. Okay. Balik tayo sa attendance check. We have Miss Moral. Miss Moral, yes, I can see you. Hello, Mr. Giselle Vitalicio. Miss Vitalicio.
Present, ma'am.
Okay, hello, Miss Nones, where are you? Miss Nones. Miss Nones? If you cannot comment, please at least write in the chat box. Miss Nones. Miss Ria May Nones? Not around. Okay. Next, Miss Nava. Miss Nava, where are you? Okay. Miss Nava.
Present, ma'am.
Miss Noble. Good morning, Miss Noble. Where are you?
Hello, ma'am.
Okay. Miss Luto. Miss Luto.
Present, ma'am.
Okay. We also have Miss Makiling. Miss Makiling. And then we have Miss Lorica.
Present, ma'am.
Okay. Miss Okol.
Present, ma'am.
Miss Barinas.
Present, ma'am.
Okay. We also have Miss Nokoro. Miss Rita, are you around? Miss Rita, are you around? She has left the meeting. Miss Mayer, Mr. Mayer. Hello, good morning.
Present, ma'am.
Okay, Miss Marquez. Hello, Miss Marquez. Are you there?
Ma'am, present.
Miss Manto. Miss Manto.
Present, ma'am.
Mr. Masuela. Mr. Masuela, where are you?
Present, ma'am.
Okay, good morning. Miss Martinez, are you around?
Present, ma'am.
Miss Miliare.
Present, ma'am.
Okay, Miss Makiling. Mr. I'm sorry, there are two Makilings in your class. Mr. Dennis Makiling. Okay. Are you related to each other? No.
No, ma'am.
Okay. Miss Occasion. Miss Occasion.
Syllabus, ma'am, dato.
Aha, okay. Miss Occasion, are you around? Not around. Okay. At the moment, yes, Miss Rita, can you please mute your mic for the meantime? Okay. And then, okay, I'd like to let you understand that I have a Google attendance here. The time that you have logged in is automatically recorded also. The time that you intend to log out will also be automatically recorded. So, everything is actually recorded. Kung may plano sa inyo na mag-leave anytime during the discussion, I'm sorry, you're going to be considered absent. Okay? So, you have to understand everything is recorded and you cannot escape. Okay? Unfortunately, this is a 3-hour class and we don't have anything, we don't have much choice for that one because of the pandemic that's happening. So, this is what we're going to do. For today's session, we're going to have the orientation first, and then we're going to have our lecture because technically for the schedule that was given to us, we only have around 8 sessions. That includes your synchronous and asynchronous. Now, with that 8 sessions, we only have 4 synchronous. So imagine that 4 synchronous is the only time that we're going to have this face-to-face interaction. And, you know, it's going to be very difficult explaining some topics if we're not going to do it in this particular scenario. Now, obviously, when you're just going to be uploading it, sometimes there are things that are not properly explained or there are things that are a little bit confusing for you. So I think we have to maximize that 4 sessions. Okay, remember 8 meetings only, and then you're going to have another teacher who's going to have a discussion with you with another topic. So in my case, I am assigned to have your fluid and electrolytes. Okay, so with that fluid and electrolytes, I'm not sure if some of you have already your RLE. Have you had your RLE already with MPW, or is it your off?
Ma'am, yes.
Yes,
Group
ma'am.
1 po.
So group 1. So for the group 1,
Yes, ma'am. Group 1 po.
Your topic is also fluid and electrolytes. So in that case, some of the topics in that particular learning packet are also going to be discussed in the lecture. So we're going to maximize again that 3 hours. Okay? So to have a system, of course, it's going to be a little bit stressful on your part to have the 3 hours straight of lecture. Nobody has that type of super strength to have your focus of concentration and attention. So what we're going to do is we're going to have 1.5 hour and then 10-minute break, and then another, the remaining time would be another batch or another set of your lecture. Okay? So is that fine with you guys? Okay, I'm going to give you at least 10-minute bladder break. Okay, and then so that I'm going to ensure that you are really listening to what I'm talking about here and not just leaving your laptop or your phone during the session. It's important that I'm going to have a post-evaluation of what I have discussed. So after each session that we're going to have, we are going to have a recitation. So I'm going to be calling you randomly, and then you're going to answer my questions, okay? Whatever I have discussed are all going to be the questions that I'm going to give to you. Is that understood? Okay? Para walang parang hindi gulangan. Kasi yung iba sa inyo, biglang nawawala kung saan anong ginagawa. Tapos, most of you are very, focused in listening, and then some just don't mind. So, in that case, I'm going to do random. Okay, random picking of those who are going to answer my questions. Anyway, that is still a part of your grading system. Okay, so are we ready for the orientation of our syllabus? Because it's important that I have to explain this to you so that you are going to understand. Okay? So as of the moment, I have 35 participants. May I call, okay, Miss Desperos, you are around already. Hello, where are you? Miss Desperos, are you around? Hello.
Yes, ma'am.
Okay. Mr. Mars. Mars talaga. Okay, Mr. Mars, okay. Parang dalawa lang ang na-add. Okay. And there are, according to my access, I think there are 41 of you. I mean, in the Google Classroom, there are 41 of you. But, it seems to me that there are only 35. Okay, 41 students have enrolled in my class. Okay, that's 41 students. And then, there are only 35 of you. I am going to check later on who are absent. Okay? Again, if you have problems with your internet connection, you can always post in our group page. Okay? Yes, Mr. Shazan. Paano kung nawala yung connection, ma'am, tapos mag-reconnect ulit? It's okay. Again, it is recorded. Logging in and logging out is recorded. So, I would understand that you have problems again, tapos bumalik ka, I would understand that it has something to do with the internet connection. Okay? But if you have not logged in the whole time that I have had discussion, you are considered absent. Okay? Okay. So if that's the case, let me share to you your, for a while, give me a few minutes. I'm going to share to you your, I'm sure you have seen already your syllabus. I have posted it in your group page. I mean in your Google Classroom. Dali lang. Okay. Ayaw niya. Sandali lang. Mag-open na lang ako ng bago. Let me share to you again. I'm going to attempt to share again. Okay, there you go. Okay, can you see already what I am presenting to you guys? Can you see? Please comment. Do you see already? Okay.
Yes, ma'am.
Yes, ma'am.
So this
Yes,
is your syllabus for NCM 112. Okay, so you have seen that is your philosophy, your vision, mission, as it is the preliminaries for any type of course syllabus. So let's move on. So this is technically the course title. This is actually a new curriculum. Okay, NCM 112 is a new curriculum, a new course curriculum, because in the previous curriculum, this is a mixture and a combination of your medical surgical nursing of one MS, that's NCM 103, and another MS, which is NCM 104. So technically, this is, if I am going to be honest with you, a little bit too compressed, because so many topics are actually placed in one NCM. Okay, so when we actually saw the list of the topics, so we were having anxiety because we don't know if we are going to be able to deliver it to you guys, but that is the mandate of CHED. Okay, according to the CHED and according to the technical working committee and technical committee for making the curriculum in the higher education for nursing program, this is what they want that you're going to have for third year. So this is a care of clients with problems in infectious, okay, infectious, inflammatory, immunologic responses. So anything that has something to do with your infectious process, your communicable diseases, your inflammatory process, your integumentary disorders, and your immunologic responses, that will be your autoimmune disorders, such as your systemic lupus erythematosus, your HIV. Okay, these are the topics that you are going to be expecting and anticipating for this first three. Okay, first 3 topics. And I think in my case, that would be again me. I'm pretty sure it's me again. Okay, so next group of topic would be your fluids and electrolytes. So that is going to be our course, okay, for this particular session. So for the 8 weeks, 8 meetings that we're going to have, we're going to be dealing with your fluid and electrolytes. So with that fluid and electrolytes, I'm going to be discussing that to you later on, okay, when we are going to move on with the lower parts or some parts of our syllabus. Next is going to be your cellular aberration, and that's going to be your cancer nursing. In the old curriculum, your cancer nursing was a topic or a course given for 4th year students, but this time around said, okay, and then our experts from the nursing program wanted it to be included in our NCM 112. And that will also include your acute and chronic infections, okay? So we have your infectious, inflammatory, immunologic, and then also I've forgotten to mention your problems in oxygenation. When we say oxygenation, it's not just about your pulmonary disorders or respiratory disorders. This is going to be about talking about your cardio or your cardio disorders as well as your pulmonary disorders. So you have also another instructor for that one, that is Mr. Jeff Bautista. Okay, so for Travel B, you're going to have 3 instructors. I am going to be assigned on your fluid and electrolytes and also your infectious, inflammatory, and immunologic responses. Okay, and then also for cellular aberration or cancer nursing, that's going to be under Ma'am Melchi Pulido. Okay, so this is an 8-unit lecture, okay, 6 units RLE, so 120 lecture hours, and technically that 8 hours is going to be translated into 3-hour synchronous sessions, okay, and the rest of that would be in their asynchronous learning sessions, okay. So for this time, okay, so these are the things that are expected or learning outcomes or the goals or objectives after the end of this class or after the end of this course. So for the first part, okay, I would like to give you heads up also that we are going to be not technically, okay, following the syllabus because there is, modifications there depending on the availability of the instructors or the assigned topics to you for that specific moment. So in this case here, the first ones, because we made this one prior to August, I think. Okay, so we made this one April. So during April, when there was, the peak of the pandemic scare, okay, and then, problems with going to school and off-campus learning. So we were told to do this and make our syllabus, and we were not privy to knowing the schedule because it was only given, I think, a month before the start of classes, but this was done way before. So technically, we are not going to follow this one. We are going to follow the schedule given to us, and then we follow the topics under that specific schedule. So if the schedule for us right now is fluid and electrolytes, then we're going to skip oxygenation and we move to your fluid and electrolytes. Okay, so but anyway, let's discuss first what's in the content of our syllabus. So for the first unit, that is oxygenation disorders. So as I've mentioned earlier, you're going to have your cardio disorders and also your pulmonary disorders. So for your cardiovascular disorders, you have here your assessment, you have your diagnostic examination. We would not be talking too much about your anatomy and physiology because this has already been discussed to you in your anatomy classes. So instead of discussing it to you in the synchronous session, we would deem it appropriate that it's going to be translated into your asynchronous session. So again, if you need to review on that one, please browse your notes from your anatomy and physiology again from before, and then okay, I'm going to also give some parts about anatomy, okay, but I'm going to be talking about fluids and electrolytes. Okay, next, so we have here, so this is for again your cardiovascular problems. You have your dysrhythmias, you have your conduction abnormalities, your coronary artery diseases such as your atherosclerosis and your angina pectoris, myocardial infarction, okay, all of these heart complications. Okay, so I would like to ask everyone, which units have you been assigned to when you had your RLE in the hospital? May I ask anybody? saan kayo na-assign? Which units have you been deployed to? Hello?
Ma'am, Pedia Word.
Video word only. Any more? Any units aside from
Ma'am,
video?
NICU.
Nico?
Nico.
That's not Nico. Nico.
Nico.
Okay, Nico and Nico and video only. Okay?
OB ward, ma'am.
OB word. So,
OBDR.
okay.
OBDR, ma'am.
OBDR, Nico, and then Pedia. So, these are basically maternal and child nursing. For those who have been assigned in the pedia ward, which pedia ward are we talking about? In Lorma or in ITRMC?
ITRMC, ma'am.
Oh, ITRMC. Lorma and
Lorma.
ITRMC. For those who have been assigned
Lorma, ma'am.
in pedia ward of ITRMC, I'm pretty sure you have seen how toxic it is. Okay? Now, I hope in the future you're going to be assigned really in the medical surgical ward so that you are going to appreciate, okay, how it is to take care of clients who have this particular illnesses, okay, especially in ITRMC because there are varying cases there that you will learn, really learn, okay, especially in the management of these disorders. So I hope in the future you're going to be assigned because these disorders are technically in the medical ward, okay, medical ward 1 and medical ward 2 of ITRMC. Okay, I'm familiar with the setup of ITRMC. I have not have so long of a duty in Lorma Medical Center. So for those of you who are listening to me, maybe I am going to be talking about discussions of my experiences in ITRMC. So it's a public hospital and not much of the facilities are actually provided for the patient. But anyway, let's go back to the content. So again, we are going to be in the first part of the oxygenation topics, that is your heart disorders. So you have there rheumatic fever, rheumatic heart disease, Raynaud's, etc., etc. And then we're going to have your respiratory disorders. So again, it starts with your anatomy, your diagnostic examination, your assessment, and then you go to your pathophysiological mechanisms, or the exact or specific illnesses that are going to be discussed to you. So you'll have your upper respiratory tract disorders, like your sinusitis, pharyngitis, tonsillitis, and you also have your lower respiratory tract infections, your pneumonia, your severe acute respiratory syndrome, your ARS, your COPD, etc., etc. Okay, so basically oxygenation is about pulmo and cardio disorders. Okay, you are going to be expecting that the discussions or the illnesses would be relative to cardio and pulmo disorders. Okay, now let's move on to the next part, that is your fluid and electrolytes and acid-base imbalances. By the way, the acid-base imbalances will also be discussed further by Sir Jet Bautista, which is in your oxygenation, because basically your acid-base imbalances has more bearing, especially if you have problems in your oxygenation from oxygenation illnesses, such as those who are going to be hooked to a mechanical ventilator. Okay, so I will be discussing a part of your acid-base imbalances, but most of that will be discussed by Sir Jet Bautista. Okay, now this is our topic. This is unit 2. This is fluid and electrolytes and acid-base imbalances. Okay, so fundamental concepts, that's what we're going to be discussing later on, as well as your fluid imbalances, such as your fluid volume deficit and fluid volume excess. Okay, so you have here your books are provided for you. Our textbook is Gunnar and Sudart's, but I am not very particular about the textbook that you're going to use because your management and treatment for diseases are the same for all. So any medical surgical book is applicable and is acceptable. Okay, so sometimes also whatever is written here, our discussion or our activity might not be followed, okay? Especially that you have your concept map, formulating, charting, etc. Games, we cannot actually do that specifically because it's very difficult to have it in your asynchronous. That's why I have opted to have our recitation so that there will be class participation as well. All the other activities will be provided in your asynchronous session. Okay, so as I hope you are focused on our discussions, because again, I would like to repeat, we only have 4 synchronous sessions. Okay, next, so today we're going to have later on, by the way, that's your fundamental concepts as well as your fluid imbalances. And then next meeting, or maybe I might be giving this to you through your asynchronous learning because we don't have much time. So for the four, that's your fluids and then your electrolytes. You have your burns and your shocks and then your renal disorders. Okay, so kulang talaga yung oras if we're just going to be relying on your synchronous sessions such as this. Okay, so I might be uploading this to you tomorrow, your electrolyte imbalances. Okay, electrolyte imbalances. Next, we have your shock. So that's another topic there. So it's a little bit, how do you call this one? The concept of shock is not just your shock being surprised. We're talking about your pathophysiological mechanisms that happens when there is your shock. Okay? This is going to be discussed also in the latter part of our sessions. Okay, so this is another topic. Okay, this is another topic which will take time for our synchronous sessions, and then we have your burns. Okay. For the burns, I think in your learning packet for fluid and electrolytes, that also includes your burns. So aside from your fluid and electrolytes itself, you also have your burns as another learning packet. So I hope we can move on as fast as I can for the discussion of the burns because there are instances, there are computations there, by the way, especially in your fluid resuscitation, okay? So, this is your burns, okay? So, that's another topic. So, we have fluid and electrolytes, we have your shock, and then we have your burns, and then finally, we have your renal disorders, okay? The concept about your renal disorders is very, very long because that includes a lot of your infectious processes such as your UTI, okay? You have your AGE, familiar, if you have been assigned in the pediatric ward, okay? I think the illness such as your Nephrotic Syndrome and your acute glomerulonephritis is a very common scenario in room 3 of pedia ward. Have you handled clients who have your AGE and Nephrotic Syndrome, guys? Anyone? Hello? Are you still around? Okay. Anyone who can answer my question? Hello? About nephrotic syndrome and your acute glomerulonephritis. Who among you has handled your nephrotic syndrome and your acute glomerulonephritis? Has anyone handled? Especially for those who have been assigned in pediatric ward. Have you handled? Wala?
None, ma'am.
Wala sa inyo?
Wala, ma'am.
None, ma'am.
Ano gano'n ang hinahandle ng
Wala,
patient?
ma'am.
Ma'am,
Which-
naririnig lang namin during endorsement AGE.
AGE.
But
So
hindi
you were
namin
not
sure.
allowed to handle clients who are in room 3? Saan room lang kayo na-assign? Which rooms have you been assigned only and then? Saan lang kayo na-assign? For those who were assigned the pediatric ward of ITRMC, saan lang kayo na-assign, guys?
IIT.
ITRMC. Diba, many of you have actually told me that you are assigned in ITRMC pediatric ward. Sino yung mga na-assign sa pediatric ward at saka anong room lang kayo na-assign? Okay. Who among you have been assigned in the pediatric ward, ITRMC, and which rooms have you been assigned to? Anyone? Yes, you can answer my question now, guys. Hello?
Ma'am, sa normal lang.
Sa normal lang kayo lahat? Kasi sabi nyo lang sa akin kayo
Hindi,
na may ITRMC kayo eh. IT. Who among you then? Who among you have been... I'd like to know because I'd like to assess how far are you with your exposure. Ang hirap mag-explain kapag wala eh. Okay. Sino sa inyo? So, come on, you have to participate, guys. You can talk now. You can open your mic now and say something. Baknotan. Miss Occasion, baknotan kayo. So, I think most cases there are like, upper respiratory tract infection, o di kaya asthma, inacute exacerbation, ganun-ganun lang yung mga cases doon, di ba? How about the others?
Yes, ma'am.
Yung mga na-assign sa ITRMC, wala. Talaga? Come on, guys. Don't be shy. Come on. Wala. Walang nasa isip nyo. Sige. Okay. If you have been assigned, sana na-assign kayo doon. Okay? Sana na-assign kayo doon. I'm going to resume my presentation again. Okay? Sana na-assign kayo doon para ma-appreciate me so that you could appreciate what it is to have kidney disorders at a very young age. Now, again, FYI, just a small nutshell of information for you. Acute glomerulonephritis or nephrotic syndrome in your children could be a precursor to renal failure. When we say renal failure, that is kidney failure. And there's no way that you can live long when you have your kidneys failing and shutting down on you. Okay? So, I hope, sana na-experience nyo mag-alaga ng clients who have your AG or nephrotic syndrome. Anyway, this is for your topics for our fluid and electrolytes. You also have your renal failure here, the last part, okay, which is quite again taxing because there's a lot of things to discuss in this area. Okay, so that's going to end. That's going to be the coverage of our fluid and electrolytes. Okay, so yan, lahat yan. But for your learning packet, you don't necessarily need to go over until renal failure. It's only until burns. Okay. So next topic, next session, again, would be me. If I'm not mistaken, it's going to be me. So that is going to be your inflammatory and immunologic responses. So anything that has something to do with your integumentary problems, your inflammatory problems, and also your autoimmune disorders. So again, the preliminaries for any unit is going to be your risk factor assessment, you have your anatomy, physiology, etc., etc. Okay, and then next we are going to have our pathophysiological mechanisms. So what are these illnesses under inflammatory disorders? Usually relative to your integumentary system. That's going to be bacterial infections. Okay, your acne, that's a part of that. Okay, we are going to be discussing that. Okay, pictures are a little bit gross, but then we have to understand we are nurses, okay? And then we also have your bullous diseases, your parasitic infection, and then for the immunologic responses, that would include your infectious disorders, that would mean your vaccine preventable illnesses. So if you are familiar with your expanded program of immunization, that is basically it. Lahat na nakikita niyo dyan, that's basically your EPI, okay? So that includes your polio, your tetanus shots, your measles, your diphtheria, pertussis, okay, all of that is your EPI, okay. And then next, we're going to have, again, another set of infectious diseases, communicable diseases, especially that, okay, you are young people who are, very curious about things, and let's face it, we are nurses here, so many of you are sexually active, so you are going to have to understand that as nurses, we also need to know the basics and the principles of your STIs or your sexually transmitted infections or disorders. So that includes your AIDS, your STDs, your chlamydia, gonorrhea, yung sinasabi lang tulo, okay, or your clap, okay, for example. So that would be included in our discussions, and then we move on to your immunologic responses. So for your autoimmune disorders, we have, aside from that one first, we have your hypersensitivity reactions, those who have allergies to simple food intake of like maybe peanuts or whatever, so that would be your hypersensitivity reaction. And then you have your autoimmune disorders, which is your SLE, your rheumatoid, etc., etc. All of these are actually in your textbook. So if you have if you would like to read more on that, you can always use any medical surgical textbooks. So I think that's basically it for your infectious and inflammatory. All the other parts here are just your management, pharmacologic management. You have your surgical procedures, etc., etc. Okay, and then finally we go to your cancer nursing, which is I think if you would like to understand it, in the 4th year class, this is a whole term, but in NCM 112, this is just 8 sessions. So imagine how Ma'am Melchi is going to compress everything for you to understand about your cancer nursing. Okay, so this is going to be Ma'am Melchi's coverage. So preliminaries again have to be talking about the principles and your perspectives about your cancer nursing, and then your treatment modalities. What are the options that a client who has cancer is going to be expecting or anticipating? We also have your chemotherapy, your biotherapy, etc. And then you move on to your care supportive therapies, okay? And then finally, symptoms, okay. Finally, we have your these are your oncologic emergencies, are your complications of your therapies. Okay, so even if you have had your chemotherapy, does not actually mean that you're going to be cured of cancer, because technically cancer is incurable. Okay, it's just basically about preventing it from happening. So, and then we have your clinical management of your major types of cancers. So we have from cephalocaudal, so brain, you have your breast, you have your colorectal, you have your stomach cancer, you have your genital urinary types of cancer, you have your gynecologic, obstetric. If you have been assigned in OB ward, if I'm not mistaken, there's one row there. I mean, one row, is it one row? Okay, one part of the unit or the ward there, which is basically for gynecologic disorders. Okay, so yes, they have a space there for clients who have that. And then you have your head and neck problems, your leukemia, your lungs, etc., etc. Okay, so these are ang dami. If you're going to look at that, okay, and then finally you'll have your final exams. Okay, I think in your case, ang mauuna is me, and then if you can remember, I have posted a picture in your classroom. Can you remember who's next after me? Is it Sir Jet? Is it Sir Jet? About oxygenation. And then it's going to be me again, and then Ma'am Melchi Pulido, if I'm not mistaken. So I guess that's basically what's happened, what you're going to be expecting, the content of your syllabus. Okay? Do you have any questions for our content in the syllabus? Is it clear, everyone? Is it clear? Yes, guys?
Yes, ma'am.
Okay, is it clear? Is it clear?
Yes, ma'am.
Okay.
Yes, ma'am.
So let's move on to your textbooks and your reading and reference materials. As I've mentioned, I am not particular about which medical surgical books you're going to use, because basically all of the topics are the same, management are the same. Maybe there will be updates, and that will be
Yes,
published
ma'am.
researches, and then that's going to be in your references, okay? But wala akong limitations for you when you're going to use your textbooks. Any will do, as long as it is your credible textbooks, okay? Credible references. Wikipedia is not credible, so please use scholarly authored books, okay? Or journals for that matter, okay? So we have here your videos, etc., etc. Every now and then I'm going to be posting videos about management, procedures, or treatment of our disorders. So I am pretty sure that this is familiar to you, your course evaluation. Okay, as your class standing, this has been explained to you since first year, because pareho lang siya, wala pong nagbago sa course evaluation. Okay, next, classroom policies. This is not applicable. Technically, everything is not applicable because we are not on ground, but I have uploaded in your Google Classroom what it is to have your house rules, especially if you're going to do your synchronous sessions. Okay, and then next we have I think that's it. Okay, this is your consultation hours. I am available anytime. You can just send me a message, or maybe email me for that matter. I am available anytime. Okay, so I think that's basically our syllabus for NCM 112. So are we clear now? Is it okay now? Can we start? Are you ready? Are you ready pala, guys? Are you ready? Yes. Are you ready? Okay na ba tayo dito?
Yes,
Yes,
ma'am.
ma'am.
Okay. I'm going to... Okay. Yes. Thank you so much. Okay. So, asan yung attendance niyo? 39. Okay, 39. Very good. Sino yung bagong dating? Miss Maniano, you are around already. Mr. Okikenta, yes, you are around already. Mr. Mulgado, okay? And there are still 2 more people who have not logged into this class. Again, I would like to remind everyone, for those who came in late every time that you're going to log in or log out, whether it's going to be accidental or intentional, okay, they are automatically recorded. Okay? Understood? Now, let's move on to our discussion. Nakakahinga pa ba? Okay pa ba? Okay? Take a deep breath, guys. Okay? Kaya natin to. Okay. So, let's have our discussion now. We are going to have... Alright, sandali lang. So we have... I'm going to start discussing about your fluid and electrolytes, okay? So please, ready your notebooks. You need to write down all of this because later on after this, we're going to have Q&A. Okay? Can you see already my discussion?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, is it clear in your end?
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
So this is your fluid and electrolytes. Okay. Yan. Oh. As a review of your anatomy and physiology, mabilis lang ito. Okay. Fluid status of a human body, we have what we call your homeostasis. And when I think some of you have been my students in biochemistry, and we have discussed about homeostasis as a balance that has to be maintained in the body. Okay. Any type of imbalance would mean the client is susceptible to your illness. So, fluid status of human body, you must have homeostasis, and that would include a balance of your fluids, solutions, plasma, etc., etc., also your electrolytes, and even your acid base, okay? And for everyone's information, body water intake and output is approximately around 2,500 ml, or that's 2.5 liters per 24 hours. Ano ba yung sinasabi nila? You must have at least 8 glasses of water every day. Do you do that? Do you do that? Guys?
Yes, ma'am.
Okay, very good.
Yes, ma'am.
Yes, ma'am.
Because there are some people who I know, yeah, you don't. Okay, if you don't do that, good luck sa iyo. Later on, your kid is going to complain about it. Okay, and then there are some people who I know only drinks. They cannot even drink one 350 ml bottle of distilled water. It's very difficult for them actually to, consume all of that, and that's going to be a problem later on. We are going to be discussing about that in your fluid deficits later on. Okay, so this is your fluid status of the human body. That's your homeostasis. Okay, an adult body has 40 liters of water. Technically, for any adult, guys, no expletives, please. No cursing. You mute your mic. Okay, so 40 liters of water. And I'm not just talking about what you drink. I'm talking about the whole composition of your body. For an adult man or woman, that's technically around 60% of body weight is basically water. Okay? There are some other references which says that it will go from as far as 60 to 70%. Okay? So 2/3 of that is, according to your anatomy and physiology, intracellular. Most of that is found inside your cell. Okay, inside your cell. And then some of that, 1/3 of that, is found outside your cell. So extracellular. From that extracellular, that's going to be 80% in your interstitial spaces, the spaces in between your cells and tissues. Okay, now the collagen part there, outside of your intravascular compartment. Okay, you have there your interstitial spaces, and then you have your intravascular compartment. From the word intra, it means inside. And your vascular, that means your blood vessels. What are these blood vessels that we have? You have your arteries, you have your veins, you have your arterioles, you have your venules, you have your capillaries. And all of this, and that water, okay, 1/3 of that water, or 1/3 of that solution is actually inside your vascular compartment, okay? So that's what's making up 60% of the body weight, that water there for any adult, female or male. Now, when we have your infants, okay, we are going to be discussing, or we are going to be expecting that, the babies have more water because, your system are not yet well defined and not well formed. So, technically, they are having as much as 70 to 80% of your water. And then we have your elderly people those who are aged 50, 60 years old and above, they have around 40 to 50% of water. Why is that? Because, okay, you have to understand that the skin actually houses most, okay, houses most of our your water. Now, look at most of the elderly people in your surroundings or in your family, diba? Their skin is a little bit wrinkled. They have lost their elasticity. They have lost their characteristic as what you see in many young people, okay? So that also affects the composition of water inside their body, okay? So if that's the case, 40 to 50% water, okay? And then infant is 70 to 80% water. So guys, please write this one down because I'm not going to give this PowerPoint to you. You're going to have to write this one down. Anyway, this is recorded. If we need to have a review, I will upload this video or this session in our Google Class. Okay? Next, we have, so yeah, and this is what you see there. So 70 to 80% for the infant, for the normal adult, you have 60%, and the elderly person, 50%. Again, you have to understand they are distributed accordingly in several compartments. You have extracellular, you also have your intracellular. Okay, next. So, fluid body composition. Since we have 60% of your body weight being composed of water, okay, that will also include your electrolytes, which is running all over the place. That includes inside the cell, that includes outside the cell, that includes in your intravascular compartment, that's all over your body and systemically found. So, aside from the water, that includes also your electrolytes or substances that become charged particles in solution. Now, in your biochemistry, which of these electrolytes have we discussed? Anybody? Anyone? Dapat meron pala akong listahan dito para magtawag eh. Anyone? Mr. Shason, are you around? Can you answer my question? Give me at least 3 electrolytes that you know.
Electrolytes.
Yes.
Potassium.
Yes, correct.
Sodium.
Sodium, correct. Very good. Chloride, yes. Calcium, magnesium, lahat yan, we are found endemically in our body. Okay? And later on, we are going to be discussing about what it is to have hyper, mean a lot of the electrolytes, and what it is to have your hypo, which means low electrolytes. Okay? And any type of abnormality, again, okay? Any type of abnormality will actually, have an effect on the function of the system or on your body, okay? So, again, we also, aside from that one, we also have your hydrostatic pressure and osmotic pressure. I think this has been explained well in your anatomy and physiology. Later on, I'm going to be discussing in detail as a review kung ano talaga yung hydrostatic pressure and osmotic pressure because I think some principles of this are actually asked in your learning packet, okay? So, balik tayo doon. So, we go back to your body fluid distribution. So, I've mentioned earlier that you have your intracellular fluid, so inside the cell, okay? That would also include your potassium, magnesium, okay? And if you can remember in your anatomy and physiology, piso, the, how do you call this one? Your, I'm going to write piso. Are you familiar? Piso.
Potassium in sodium.
Correct. That's your potassium inside and your sodium outside. Very good. So these are the things, or these are the electrolytes found inside the cell, and you have your sodium, which is found outside the cell. Okay? So again, that will be discussed in detail once we are going to have our electrolyte imbalances. Next, you have your extracellular fluids. So the fluids outside the cell, aside from, yung sabi ko nga kanina, the salt in your piso, that's your sodium outside, and that will also include your chloride. That's why sabi nga nila, sodium chloride. If you're going to be infused with your intravenous fluid, your sodium chloride is available readily. Okay? So especially if you have problems with your dehydration. Okay? So this is where your transportation of nutrients, oxygen, and waste products occur. Basically, that's in your extracellular fluids. Okay? So if you're going to see the picture here, ayan, this is your picture. So you have the fluids inside your intracellular, okay? And then there are, exchanges or there's leakages. I mean leak, okay? Leak because, there is movement of your fluids, okay? And there's movement of your how do you call this one? Your oxygen, your carbon dioxide from one point to another. So from interstitial fluid, okay, intracellular fluid, going to your blood plasma, going to your lungs. So if you can remember, okay, if you can remember, intravascular compartment, you have your arteries, your venous, okay, and then in between that one, you have your tiny capillaries, okay, and this help facilitate all of this transport, okay, and it's through your body fluids that it is going to be transported. So without your fluids, hindi magaganap, or you are not going to have this mechanism that is going to help your body achieve your homeostasis. Okay? Am I clear with that, guys? Okay? Next. Okay. Next, we have locations of your ECF. Okay, we have 3. You have your interstitial, okay, so ECF, we have your intracellular, that's one part, and then we have your extracellular. In the extracellular, what are under these compartments? The first one on the list is your interstitial spaces. I have mentioned earlier that the interstitial spaces are the ones, okay, which which are spread all over and in between your cells, okay. It's like a gel there, and then you have your collagen there, and then you have your interstitial fluids going on in between of all of this gel and your collagen and your tissues. Okay? It's not just basically na paglabas ng compartment mo, tubig na agad. No, that's not it. It's basically you have cells there, you have your collagen, you have your gel, and then you have your interstitial fluids. They run around in this location. Okay? And then you have your intravascular, from the word vascular means arteries, your veins, okay? Ito yun, no? Okay? And this is where your plasma is, where your blood actually is. So, when you're talking about fluid movement, you need to understand how your intravascular fluid actually does its job, specifically in maintaining your homeostasis. And then you have your transcellular, your fluids in your urine, okay, when they are actually made by your kidneys. And then you have your digestive secretions, which runs around the linings of your stomach, etc. And then you also have your cerebrospinal fluids. If you can still remember your anatomy and physiology of your brain, okay, your neurologic system, you also have your pleural, your synovial, intraocular, in your eyes, where it is necessary to maintain your moisture there. You have your gonadal and you have your pericardial. We have pictures for that one, by the way. So we have here, okay, and what is this one? That's your cerebrospinal fluid, okay, and you have it is very important to maintain your homeostasis again in your brain. Any type of excess production of your cerebrospinal fluid will result to what? Familiar, pediatric disorder. If there is an excess production of your cerebrospinal fluid, what is an expected illness among pediatric patients? Anybody? Oh, naalala nyo na? You cannot remember? If there is excess production of your cerebrospinal fluid in the brain. Okay, ito yun, no? The blue part there, okay? And it's circulating all over because it actually helps in nourishing your brain. So what is an abnormality that is expected? This is a pediatric disorder. Any
Hydrocephalus.
Hydrocephalus. Very good. Okay, so that is your hydrocephalus. Again, sabi ko nga, it is important that there is balance in maintaining each fluid, whether they are in your transcellular, in your intravascular, in your interstitial, etc., etc. Again, this is your pericardial sac, okay? If you can remember your anatomy and physiology, you have your pericardial sac covering your heart, and then in between that, so there is no friction, unnecessary friction, with your pericardial sac and your heart organ itself, okay? In your heart organ itself, yan. Okay, this is actually your pericardial fluid. There you go. Okay, so what does it do? It helps facilitate again the nourishing the part of your heart organ, and at the same time, okay, if there is an abnormality with your pericardial fluid, I mean there is excess production of your pericardial fluid, what's going to happen there? If you can remember your anatomy and physiology, okay, paano kung madami masyadong pericardial fluid there? what could actually happen? Can you still remember? You have your sac. Okay, I'm going to make it logical for you. You have your sac. It will cover your heart. And then, in the middle of that one, there's your heart. But in between that sac and your heart is actually your what? It's your pericardial fluid. Ngayon, kung masyadong madami, there's so much of your pericardial fluid that is produced, and it's just accumulating and accumulating in that specific area, what do you think will happen to the heart? Anyone?
Pressure.
Huh? It's going to what? Anyone? Wala?
Prevent from pumping normally.
Obviously, it's going to be preventing pumping normally. Why? Because the fluid is going to obstruct your contractility of the heart, and if that happens, you have an illness, and that's your cardiac tamponade. That's going to be discussed by surgeon. Imagine when you have your cardiac tamponade, your heart just quivers. It just contracts so much kasi hindi niya kaya eh. I mean, it's being obstructed. Somebody is stopping it from contracting properly. And the one that's stopping it is actually your pericardial fluid. Okay? And that's a red flag on your heart, especially if you have heart disorders. Okay? So again, these are the classic things or your illnesses that are expected if you have problems with your fluid imbalances. Okay? And then we have here. So this is, okay, remember in your skeletal system, okay, you have there your synovial fluid. Okay. This is your synovial fluid. This is your synovial fluid. Okay? And where is this? It's in your joint. So we have so many joints. Your fingers have joints, your knees have joints. Okay? And these are bones, right? And the bones, when they have a friction, okay, it causes pain. Now, in order for us to avoid that and to nourish this part here, okay, we have your synovial fluid. However, it's going to be different or difficult if we're talking about the elderly patients, because the elderly patients, they have degradation or deterioration of the functions of the body system. Fortunately, unfortunately, that includes the loss of your synovial fluid. That's why we have what we call your arthritis. Okay? And because why? We have lost your synovial fluid. Okay? So am I pretty clear with these types of your transcellular fluids? Okay? You have questions for that? Anyone? Guys, you have questions for this one? Are you still around? I'm not pretty sure. Are you still around, guys? You can answer me right now.
Yes, ma'am.
Okay, so
Yes, ma'am.
okay.
Yes, ma'am. Yes, ma'am.
Next, we move on to your solutes. These are just definitional terms that you have to understand, especially that we are going to be dealing with your imbalances. Okay, so the first thing on the list, I think in your
Yes,
biochemistry,
ma'am.
this one has also been discussed. So you have your solute, it's the substance that is dissolved. And you also have your solvent, and in the universal solvent is your water. Now, if you're going to compare it with, actual scenarios in our everyday lives, we have your mug, and then you have water in that mug, that is your solvent, and if you put coffee, that is your solute. Okay, understood? So that's your solute and your solvent. Then next, we have what we call your molar solution. So this is the number of gram molecular weights of solute per liter of solution. This is more represented by what we call your osmolality. Now, your osmolality is the concentration of how much substance has been dissolved in that water. Okay? So, kapag mas mataas ang osmolality, what does it mean? Again, I would like to repeat. Osmolality is the concentration, okay, the percentage concentration of
Highly
solute.
concentrated.
Okay, highly concentrated. Means to say there's a lot of the solutes in high osmolality. Okay, highly concentrated. And as an opposite, on the flip side, when you have low osmolality, therefore the situation there or the environment there is you have less concentration of solutes. Therefore, mas marami ang tubig kapag meron kang low osmolality. Understood? Okay? So that is your high osmolality and your low osmolality. They are also likely the same for your osmolality. Okay, again, difference lang is that for your concentration of solutes per kilogram of water, that's your osmolality, while for your osmolality, that is solute per liter of solution. Okay, per liter of solution, not per kilogram of water. Okay, so that's basically your osmolality. Now, let's go to your mechanisms of body fluid movement. Now, if you can remember, okay, this is yung mga movement transport from higher concentration to lower concentration, okay, and then vice versa, etc., etc. Movement of water, movement of solids. This is basically your mechanisms of body fluid movement. So, the first one on the list is your osmosis. Okay, when we say osmosis, what moves? It's your water that is moving. Okay. So, water that is moving. So, water moves from area of lower concentration to higher concentration. Okay? Area of lower concentration to higher concentration. And normal osmolality within your intracellular and extracellular is around 275 to 295 milliosmol per kilogram. And usually, when you have your osmosis, and so no, look at the picture. This one is a picture. Ayan. This picture, it says there, you also have what we call your semi-permeable membrane, SMP, okay, with your SMP. Now, see, it's the water that's moving, it's not the solutes. Again, when we're talking about osmosis, it's the water that is moving, okay, kung saan mas maraming solutes, okay, water going to where there is a higher concentration of solutes, okay. Again, same picture. In the right side, this is the result of your osmosis. Okay? So that is your osmosis, basically. Next, so we have different types of solution according to your osmolality. I'm not sure if I have discussed this in... you were not my students in pharma, okay? Because I am pretty sure I have discussed this one in pharma. So we have different types of your solutions. Okay, so we have your isotonic solution, we have your hypertonic solution, and we have your hypotonic solution. Again, osmolality. So we're talking about the solutes here, the concentration of the solutes in the water. Now, when we say isotonic, iso, it means to say it's the same. Okay, it's the same. All solutions with osmolality is the same as that of your blood plasma. Okay, so pareho ang concentration ng solution and then na ibibigay mo, okay, the type of fluid that you're going to give, okay, has the same concentration of the solution with that of the solutions or concentration of solution in your blood plasma. Example of this is your plain NSS or your 0.9 sodium chloride. Okay? Now, if you're going to infuse your IV, intravenous fluid, anong kulay ang 0.9 sodium chloride? If you have been assigned in pediatric ward, I am pretty sure that you have. No, it's not pink, guys. That's your D5LRS. What is the color of 0.9% sodium chloride? If you really did your, your IV changing, or if you really did your IV computation, sige man, ano ang kulay ng PNSS? No, it's not light blue. Hindi yan.
Green.
Green, correct. It's green in color. It's green in color. Okay? So, if that is the case, it's more likely what we say, the safest. Okay? Quote unquote. One of the safest. Okay? One of the safest types of solution that we can give to a patient with less, okay, with less problems. Okay? For a while, guys, kasi medyo naghihingalo na. Okay, next, we move on to your hypertonic solution. Your hypertonic solution, okay? Your hypertonic solution has greater concentration from the prefix. It says there hypertonic. That means high. So mataas ang level. Tonic means your solutes, okay? Tonic means your solutes. So, if you're going to introduce or infuse a client with a hypertonic solution, ibig sabihin nun, masyadong concentrated ang solution na yon. if you are going to infuse a hypertonic solution to a patient, it means to say the concentration of your solutes there is a little bit high than your blood plasma. Okay? Understood? So, the fluid with greater concentration of solution is going to also affect your cells inside your body. And a classic example of clients who have of hypertonic solution, by the way, are your D5. Okay, yung mga D5 NSS, that's yellow, okay? And then you have your D5 LRS, that's your pink. And then you have your D5 IMB, that's your violet, which is very common in your pediatric ward. You also have your D5 D5W, okay? But your D5W can be considered as your isotonic. Pero, pag may nakita kayo, D5, that means your dextrose, percentage of dextrose. And when we say dextrose, that means glucose. And glucose is actually sugar. And sugar is a substance that is going to be dissolved in water. So again, that makes it hypertonic because there is substance that is going to be added in your water. Okay, and it says here in your in our slide that cells in hypertonic solution, what happens? Okay, because masyado nga madaming solutes. Okay, there's so much of your solutes and it's actually concentrated. When it comes in contact with your cells, what happens there? Because of the solutes, it's going to suck out all water in your cells and therefore it is going to shrink. Okay? So, therefore, you have to be very considerate or you have to, very, very mindful about what type of solutions you are going to give to your client. And you have to know what is wrong with the patient. Does the client really need a hypertonic solution? Kulang ba siya ng solutes sa katawan niya? Is there lack of solutes in the client's case? Or the client only needs your water because the client is dehydrated? So, you really need to understand the type of fluids that is going to be given to your patient, okay? And in so doing, you also have to understand the types of solution that's going to be prepared, okay? Next on the list, we have your hypotonic solution. So, hypotonic solutions from the prefix hypo, it means low, okay? So, when there is low tonic, tonic means the concentration of your solutes. So, if there is low hypotonic solution, therefore, the fluid has a low concentration of solutes than your blood plasma. So, if that is the case, mas marami po siyang solution or mas marami po siyang solvent. Okay? So, technically, if you're going to think about it, you're going to understand that it's a little bit diluted because there's more fluid there than the solutes. So that is basically your hypotonic solution. So cells in hypotonic solution, okay, what happens here is that water outside the cell moves inside the cell. Kasi mas maraming solvent. There's more fluids than the solute. So when they come in contact with your cell, what happens to your cell is that it's going to absorb and absorb and absorb your solvent, which is more than your solutes. So, anong nangyayari dyan? When that happens, the cell is going to what? It's going to swell and inflate and becomes bigger and bigger. And since you did not put a break or a stop to that, what happens? It's going to burst. That's what we call your hemolysis. Okay? Especially when we're talking about blood, RBCs. Okay? They also suffer from this type of your affectation when you give the incorrect type of solutions. Now, this is a drawing, okay, of what happens when we are going to infuse isotonic solutions or your hypertonic solutions or your hypotonic solution. Look at the picture, guys. You see here? Since the isotonic solution has the same solution, there's no movement at all because pareho sila. Okay, same with your plasma and same with your IV fluids. Okay, so that's why I have termed earlier, it's one of the safest, quote unquote, safest, one of the safest, but not, not absolutely safe, especially you do not follow your proper and appropriate mechanisms for giving of your IV. So for your isotonic solution, one of the safest because it has the same concentration as that of your blood plasma. It doesn't make so much of your modification, especially when they come in contact with your cells. However, when you go to the next picture, okay, this is the next picture, that's your hypertonic solution, wherein the solution has a higher concentration. So when they come in contact with your cell, diba, solutes actually attract water. Okay, the solids attract water. Now, if that is the case, you introduce your hypertonic solution and then you have your cell. What happens to the water from the cell? It goes out. So, technically, the end result there is your cell is going to shrink. Okay, it's going to shrink. And a cell who has shrunk cannot do its job properly. And I'm not just talking about your epidermal cells or your lining of your cell, cells that line your organs. I'm also talking about even your RBCs. Okay, there are so many cells, trillions of cells in the body, and they're going to be affected if we do not properly provide or infuse these specific fluids. Next on the list is your hypotonic solution. Ayan, baliktad naman. As compared to your hypertonic, it's going to have the flip side effect of your hypertonic. So in your hypotonic solution, okay, solution has your lower concentration. If that is the case, again, because the fluid, when it comes in contact with the cell, what happens there? Since mas maraming solutes, there are so many solutes, there are more solutes, by the way, in your cell, it's going to attract water to go inside. And if that is the case, it's going to again go bigger and bigger and bigger, as I have mentioned earlier, and it's going to burst. So the end result there is still not good. Okay, so there are instances wherein the giving of hypertonic solution and hypotonic solution must be done with considerations depending on the need of your client. You have to have your physical examination for that. You also have to have your laboratory diagnostic examinations. This is what I am talking about earlier. Your hypertonic, your isotonic, and your hypotonic solution. This basically explains everything that I have mentioned earlier. Hypertonic, no nangyari, kawawa si Cello. Look at that, the RBCs look like old RBCs. What is the age of viability? Not age, the lifespan of your RBCs, guys, according to anatomy and physiology. If you can remember, you can answer now.
120 days.
Yes, correct. 120 days. So, imagine mo, buhay na buhay pa si RBCs, tapos pinatay ni hypertonic solution. It's not going to help you at all, okay? And then next, you have your isotonic. As I mentioned, there's not much difference because it's the same with your blood plasma. Last but not least, you have your hypotonic solution, which actually is going to swell, make the cell swell, and then it's going to a rupture, and that's going to be a big problem. Now, meron tayong mga hypotonic solution na binibigay sa mga patients natin with your blood transfusion, and it's not going to help at all. Imagine you need blood transfusion, and then suddenly you mistakenly, okay, si nurse pa man din yung nag-hook, maling solution ang pinartner ni blood transfusion. So, instead of helping your client to have additional blood volume through your blood transfusion, anong ginawa ni nurse? Pinatay niya yung laman ng buong blood bag. Okay, so again, that's going to be a case against the nurse. So, we have to be very, very careful for things that we are going to provide to our client. So, am I clear enough on this part of the discussion, guys? Questions? You have questions? None? No questions? Am I clear? Okay ba? Because I think I need to move on. But tayo nakakalahati. Okay! Now, let's move on. I mentioned that different intravenous solutions used to correct some abnormal conditions must need to be categorized accordingly. Okay, next we have your diffusion. So, ito, compared to your osmosis is the one which moves from one place to another. With your diffusion, it's the solute molecules which moves from higher concentration to lower concentration. Okay, so it's not the water, but it's the solutes. So, solutes means such as glucose, your proteins, your electrolytes. Ito mismo. It moves from one place to another, and it's going to be your solutes. So, there are different types of your diffusion, we have your simple and your facilitated. It's the movement of your large water-soluble molecules. Okay, because there are those which are not soluble in your water. But technically, with your diffusion, it's movement of your solutes, as easy as that. Yun lang. Okay, from area, okay, again, let's go back, from area of higher concentration to lower concentration. Yes. Next, you have your filtration. Now, itong filtration na ito, okay, it needs to have your hydrostatic pressure being affected. Okay. Later on, we will be discussing about your hydrostatic pressure because this is the pressure that maintains the fluid. It allows the leakage of fluid pala outside of your intravascular compartment. Your hydrostatic pressure is created because there is your pumping action of the heart, your contractility. Whenever your heart contracts, your hydrostatic pressure is also going to be affected. It's like basically having your hose. Okay? Yung hose mo. Pag inan mo siya, tapos you try to cover the mouth of the hose, di ba masyadong malakas yung pressure? Okay, that's basically your hydrostatic pressure. Nag-create ka. The heart is basically your faucet being open. So that's the pressure, that's the contractility power of the heart, and then the pressure that is, being obstructed by you when you try to cover the hose's mouth is actually your hydrostatic pressure. Ganyan ang hydrostatic pressure. And this allows fluid, okay? This allowed your fluid and your solutes to move from one area to another, from intravascular compartment to your capillaries to your interstitial spaces. Okay? Again, I'd like to emphasize, it usually occurs, where are you? Ayan. Okay. Sorry. This is your capillary membranes. Okay, remember, it's in your capillary where there is exchanges of your nourishment, nutrients. You have your O2, your CO2, some solutes also. Okay, so that's your filtration. Next, you have your active transport. It uses your energy, ATP for that matter. So, example of that energy is your sodium and potassium pump. Basta, it's your molecules moving a cell membrane, but it uses a specific energy. Okay, it uses a specific energy. Okay, next, we were discussing about your hydrostatic pressure and your hydrostatic pressure in your intravascular compartment. Now, there are two forces which maintains the movement of solutes and your water or your fluids inside and outside of your intravascular compartment. I'm talking about in your capillary. Basically, later on, I'm going to be explaining from your capillary and going out to the bigger vascular compartments. But basically, there are two. Okay, you have your hydrostatic pressure. Ito ang nagme-maintain, okay, kasama ni osmotic pressure to have the balance of the fluid and solutes going in and out. If there is problems with the hydrostatic pressure and your osmotic pressure, you're going to be expecting that the client will be suffering from manifestations of either of these things. Okay, so let's go first with your hydrostatic pressure. In your hydrostatic pressure, it says there, it pushes fluid volume out of your vessels into tissue spaces. So, ito siya because hydrostatic pressure is usually occurring in your arterial part of your vascular compartment. And in the arterial part of your vascular compartment, remember, your arteries has a higher pressure than your veins, okay, or your venous pressure. So because of your arterial pressure, it's a little bit high. What happens is that there's a possibility of pushing or leaking out these fluids outside of your vessels. Okay, ayan. Pakita natin. This is your blood flow coming from the heart, where there is your contractility and there's your pumping ability. And this part here, let's assume that this is the arteries. Okay, the arteries. Now, these arteries, okay, this arterial side of your vascular compartment has high pressure. And since this is your blood vessel, ayan, yung blood vessels mo, okay, nandito lahat ng fluids. Nandyan lahat yung plasma mo. That also houses your electrolytes, etc., your proteins, etc., your RBCs, etc. But you know, your RBCs, your proteins, they are so big, they cannot leak out. So basically, your hydrostatic pressure, ang nilileak out lang nila, it's just your fluids. Okay, so from inside of your intravascular compartment, the hydrostatic pressure allows, okay, because it's so high, okay, it allows it to leak out. Okay, why? Why is it important? Because it will also nourish your areas in your interstitial spaces. Understood? Okay? It also will nourish areas in your interstitial spaces. That is your hydrostatic pressure. Yes, may naka-on na mic. Do you have questions? Questions? Wala? Okay. So, balik tayo doon sa hydrostatic pressure natin. Okay. So, it pushes fluid out of the vessels into your tissue space, and that's your interstitial spaces. Obviously, as I've mentioned, it's going to have a very huge patch of your collagen. It's like a gel there. Even your cells outside also need some nourishment coming from the fluids, okay, coming from intravascular compartment. So, hydrostatic pressure, higher to lower pressure. So, very high yung hydrostatic pressure. Pagdating doon sa capillaries, okay, pagdating sa capillaries, it becomes low. Okay, it becomes low. So, from very high pressure, okay, lalabas, papunta dito, yung fluids leaking out, that's your hydrostatic pressure. And then, pag papunta na siya doon sa venous end, okay, the pressure becomes low. And this part here has a higher osmotic pressure. Okay, higher osmotic pressure. I call it your osmotic pressure because, again, your fluid goes to areas, di ba, from area of low to high concentration. Low sa labas. Kasi konti lang yung electrolytes dyan or konti lang yung solutes. Mas maraming electrolytes or solutes dito sa loob. Okay, that's why it's going back. Now, your osmotic pressure is directly proportional to your hydrostatic pressure. It means to say, if the hydrostatic pressure is high, okay, yung osmotic pressure should be low, and vice versa. Okay, that's why it should be maintained. That's why this is how your homeostasis is going to be maintained. Okay, now balik tayo dyan. Hydrostatic pressure. What if there is? Okay, what if there is so much of it? What's going to happen? If there is due to water volume in vessels, okay, I've mentioned already, you have your arterial end that's going to be affected by your hydrostatic pressure. If there is problems in your pressure, you're going to be expecting, pag masyadong mataas, what's going to happen there? Okay, you're going to have varicose veins. Your varicose veins, by the way, they are not your original intravascular compartments. For everyone's information, when you have your varicose veins, ito yung mga bypass vascular compartment. Parang national highway, that is your main thoroughfare of where all of your jeepneys and public transportations are going to be. Kaya na, since masyadong traffic, okay, our government has created your bypass, yung mga shortcuts dyan. Okay. Now, your varicose vein follows the same principle. Because there's so much of what's happening, there is too much of your hydrostatic pressure. What happens? Your body has created your bypass circulation, extra circulation, na dapat hindi naman. Okay, so because of that, some fluids will go through that circulation. That's why you are going to expect that you're going to have varicose veins because of the high hydrostatic pressure. Same also will happen if you have your fluid overload. When you have your fluid overload, masyadong madami yung laman ng vascular compartment. Again, there will be increases, okay? Increases in what is going to be leaking out. Kidney failure and congestive heart failure, from the word congestion pa lang, okay? That would mean there is a lot of hydrostatic pressure that is increased here. Okay. Next on the list, we have your osmotic pressure. Okay, osmotic pressure. Your osmotic pressure is the opposite of your hydrostatic pressure. It pulls fluid into the vessel. From outside, balik mo. Oy, sabi niya, balik kayo. Tama na yung bakasyon nyo dyan sa labas ng interstitial spaces. Balik kayo sa loob. Okay? So that is your osmotic pressure. So from weaker concentration to stronger concentration. Because again, I've mentioned that from area of low concentration to high concentration. That is your osmotic pressure. Now, this is guided by the principle of your plasma proteins. When we say plasma proteins, okay, I'm talking about your colloid. I am talking about your your COHON, your albumin. These are very, very important plasma proteins which maintains your osmotic pressure. In some other books or references, they also call it as your colloid oncotic pressure. Let me write that one. Ayan. Ay, sorry guys, hindi ko nakikita yung ano. So, colloid oncotic pressure. I'm going to write colloid oncotic. I'm sorry guys, wala po akong tab, so I'm just going to be, yes. That is your colloid oncotic pressure. In some other books where they want to be more specific, because by the way, your osmotic pressure is very, very general, okay? But for this particular scenario, since we're talking about your plasma proteins, we term it as colloid oncotic pressure, okay? Because they would like to maintain the going back inside the vascular compartment your fluids, okay? So, ayan. Sabi niya, oy, bakasyon. Tama na ang bakasyon. Dito sa labas, balik kayo sa loob. Okay? So, they maintain, okay? They maintain your fluids to be inside your vascular compartment. Ngayon, kung bagsak si colloid oncotic pressure, walang, there would be no, breaks in the amount of fluid that's going out of your interstitial spaces. So, kapag wala si osmotic pressure, nothing would stop the fluids from leaking out into interstitial spaces. Now, if you are familiar with the term manas, what is manas? It's your edema. Okay? When you have your edema, it's the fluid, it's a buildup of your fluids where? In your interstitial spaces. Ibig sabihin nun, si patient na may manas at may edema, kulang siya sa plasma proteins. Kasi bumagsak si osmotic pressure. A client who has edema has low plasma proteins. And because there is low plasma proteins, there is no oncotic pressure, which will allow the pulling back of fluid inside your intravascular compartment. Okay? So, if you're going to look at clients who have your edema, you are going to assume na, this patient is suffering from fluid volume excess and it is actually relative to the plasma proteins. Understood? That is why, for clients who have a drop in your oncotic pressure, they usually have your liver problems. Okay? Your liver, ano ang function ni liver, guys? If you can still remember your anatomy and physiology, ano ang function ni liver? Anyone? Guys, is anatomy and physiology? Yes? Anyone? Sino? Come on. Anyone? Oh, may nag-google dyan. No, it doesn't filter. That's your kidneys, guys. Yung sa inyo, may nag-google na dyan. Wala. This should be coming from the top of your head already immediately. Ganon. Ano ang function ni liver? What does it do?
Cholesterol char.
Anong char? Cholesterol char.
Bioproduction.
Bioproduction, specifically what? Nakalimutan nila ata. Ang pinaka-importante dyan is the metabolism. Okay? Metabolism. From a very crude form of any type of product or any type of molecule, is your liver is responsible for metabolizing and making it bioavailable for everyone. I mean, for all organs in the body. Therefore, yung kinain mo na meat, sino magme-metabolize yan? Aside from, yes, it's going to be digested properly, but ang pag-metabolize ng nutrition dyan, etc., okay, it's your liver is going to do that. Okay? It's the liver is going to metabolize everything so that it can be absorbed appropriately. Okay? Hindi lang si GI ang, actually your GI, the whole GI, but basically the liver is the one responsible for metabolizing everything, especially your proteins. Ngayon, kung si patient ay manginginom, if the patient is an alcoholic, remember have you seen the alcoholic patients, guys? Okay? They're the ones with beer belly, look like pregnant women. Okay? That is a sign and symptom of a client who has liver problems. A client who has liver problems will not be able to metabolize these proteins. And when there is no proteins at all, your oncotic pressure, your colloid oncotic pressure is going to be suffering. Yes, liver cirrhosis, yes. Basically, your liver cirrhosis, if you look at people who have your liver cirrhosis, they have very huge tummies or they have huge abdomen. That is a sign of your ascites. And what's happening there? Because there's no plasma protein. Bagsak si plasma protein. Yes. Nagmamanas. It's because a lot of the fluids in your abdominal compartment leaks out into your interstitial spaces. Kulang ng protein, kulang ng colloid, kulang ng albumin. Similarly, when you have your nephrotic syndrome, okay, your kidneys is also affected here. Okay, sige nga, what are the, if you can remember, what are the functions of your kidney which is relative to your fluids? Ano ang ginagawa ni kidneys? Anatomy, physiology. What can you remember, guys? Yes?
Filter.
Filters, correct. Filtration, correct. What else? What else? Fluids, ha?
They remove the waste.
Yes, very good. Removes the waste. What else?
Balance.
Yes, there you go. That's the correct answer I'm looking for. It actually is responsible for regulating your fluids and electrolytes. Now, if your kidneys is actually suffering, sino karud ang magre-regulate ng fluids mo? Nobody. Not one of your organs is responsible for that except your kidneys. Nothing can actually stop from movement of your fluids outside your interstitial spaces because your kidney is shutting down. It's not helping you anymore. Therefore, these are likely considerations that you have to understand, especially if you have problems in your colloid oncotic pressure. Okay? So again, ito ulitin ko ha. So you have here that part here, that's your hydrostatic pressure, which allows water to leak out, air fluids to leak out into your interstitial spaces. Okay, this is your interstitial spaces. Dapat, this is not accurate by the way, because dapat merong cell dyan. Mga cells. Okay? Because yung mga cells natin, okay, sila yung nasa labas. This is your intravascular compartment. And this is your extravascular compartment, which includes your interstitial spaces. So, hydrostatic pressure allows the leaking out into your interstitial spaces, okay? While oncotic pressure or your osmotic pressure allows, okay, maintains your fluid to go back inside, okay? Or allows the maintenance of your fluid to just stay in your intravascular compartment. Hanggang dito lang kayo. Sila po yung mga police. The oncotic pressure is the one which does not allow the leakage out of your interstitial your intravascular compartment. Okay? So, this is your venous and ayan. Sabi ko nga, mas pag sa arteries, mas mataas. When we are talking about arteries, hydrostatic pressure is very, very high. But when we're talking about your venous end, it's your oncotic pressure, which is responsible for maintaining your fluid inside your intravascular compartment. Am I clear with that? Okay, you can see this particular slide about your hydrostatic versus your osmotic pressure. Okay, again, uulitin ko. Fluid that is leaked out, that's the one responsible for that is your hydrostatic pressure, while the fluid that is being maintained back inside your intravascular compartment is your oncotic or osmotic pressure. Okay? So, am I clear with that? Guys, okay na ba tayo saan?
Yes, ma'am.
There you go. Now, next. So, go back to your homeostasis. What are the mechanisms that regulate your homeostasis? These are 1, 2, 3, 4, 5. Okay, medyo mahaba ito guys. Now, for the body to adapt and maintain your balance, dapat meron kang mga meron kang factors. You have your police to tell your brain, hey, something is wrong. There is fluid imbalance there. You must do something about that. And these are your agencies who will actually help you. These are the mechanisms that actually help you maintain your homeostasis. So, obviously, if you are thirsty or there is not enough fluid inside your body, what do? You drink. Especially during the summer season. This is what you do. Your brain will tell your thirst center, hey, do something about that. Okay? And then, obviously, the communication of that specific impulse is to actually drink water. Next on the list, I have mentioned earlier, your kidney is responsible for your fluid and electrolyte regulation. So regulator of volume and your osmolality by controlling the excretion of water and electrolytes out. How is it being done? Through your, what's the mechanism for the excretion of your water? It's through your micturition or through your urination. Pag if for example, in your case, you have a lot of water in there, obviously what will happen? The kidneys will regulate you to actually excrete them out. Kasi sobra na. And then, if you have your lack of water, then you have your thirst to answer that particular dilemma. Next, you have your renin-angiotensin-aldosterone mechanism. Are you familiar with this, guys? I think this has been discussed in your pharmacology, especially when we were talking about your cardiovascular drugs. Has this been discussed to you? Maalala nyo ito? Guys? Anyone? Baka nakalimutan nyo na naman. This has also been discussed in your anatomy and physiology, if I'm not mistaken. This is your RAAS. Ito yung sinasabi natin yung RAAS. Yes. It's your renin-angiotensin-aldosterone. So you have three here. Tignan mo. Renin, that's one hormone. Angiotensin, another hormone. And your aldosterone, that's another hormone. Okay? System. So RAAS. Tatlong hormones are actually being utilized here so that you are going to maintain your fluid and electrolytes, okay, and maintain your homeostasis. So, usually it starts with a drop in your blood pressure, okay? Pag bumagsak si blood pressure, okay, think about anatomy and physiology. Usually, you're going to associate it. There must be a drop also in your blood volume, right? Okay? So, ang mangyayari dyan, you have your renin, angiotensin, and aldosterone to do their job in, maintaining your regulation. So, meron tayo dito. Let's go back. Ayan ha, wait lang. Ayan. So, if there is a drop in blood volume in kidneys, okay? So, renin is released. Hindi nyo ata ma-appreciate ito. Wait lang, ito, mas maganda ito. Yan. Ito, mas maganda. RAAS is a fluid and electrolyte equalizer. So, we have here, ito, dito tayo, tingin tayo dito. Okay. We start here. Okay, we start here. A client who is suffering from a drop of blood pressure or your hypotension, okay, it's a negative feedback mechanism. Ibig sabihin, may negative na nangyari sa kanya, therefore the body has to do something immediately about it. Now, if that is the case, if this is the system that's going to be stimulated or be activated upon on, therefore, we start with your renin. Now, your renin is from your juxtaglomerular apparatuses in your kidney. Si kidney mismo, si kidney actually releases your renin. And this renin is going to do something about the release of your liver with your angiotensinogen. Okay? I hope I'm not talking Greek here because I am pretty sure this has been discussed to you in anatomy and physiology. So, this one is just basically a review. But you need to understand, kailangan ito sa fluid and electrolytes. Okay, guys? Okay? So, let me go back. So, you have your angiotensinogen, which is not helpful at all. Kailangan pa siyang i-convert. So, when your angiotensinogen and your renin is actually mixed together, then, therefore, you can have your angiotensin 1. But, angiotensin 1 is still not yet enough. So, therefore, that angiotensin 1 is going to be converted again into your angiotensin 2. Okay? And what converts it is your angiotensin converting enzyme coming from your lungs. Remember your cardiovascular drugs? Sabi niya, ACE inhibitors. Naalala, ACE inhibitors. Guys? Example nga ng ACE inhibitors, kung naalala niyo yung pharmacology. Anybody? O may nag-google na naman dyan. Ano ang ACE inhibitors natin? Ayan si ACE. Ayan si ACE. Wait lang. Hindi ko nakita yung mouse. Ayan. Ito si ACE. That's your angiotensin converting enzyme. Okay? Tapos, I am sure naiintindihan nyo kung ano ang gamit ni angiotensin converting enzyme inhibitors. That's your ACE inhibitors. Okay. FYI lang ulit. Give me an example of your ACE inhibitors. Review natin ang pharma. Dapat, this is just very, very smooth transition from one subject to another. Guys, anybody who can give me an example of a ACE inhibitor? Anyone? Wala ka dyan.
Vasotec.
Vasotec, what is the generic name of your Vasotec? Ginogol yan, no? Ginogol yan.
Enalapril.
Yes, correct. Your enalapril. What is the suffix that you need to remember when we're talking about your ACE inhibitor? It's your pril. Pril. Correct. P-R-I-L. Enalapril. Okay? Yung mga lahat ng mga pril natin. So, what does it do is it actually stops your ACE from converting angiotensin. But that's for your pharmacology. Let's go back to your RAAS. It says there, in order for you to have your angiotensin 2, you must have your ACE to convert your angiotensin 1 to angiotensin 2. The most important part of your RAAS is actually your angiotensin 2. This is your angiotensin 2. Your angiotensin 2 does a lot of things. Ang pinaka-problem mo dyan ulit is your blood volume. Dropping blood volume that has caused your hypotension. So, ano mangyayari dyan? You have your sympathetic activity. Ito na naman makita. So, this is your sympathetic activity. Your stimulation of your SNS. Remember, your sympathetic nervous system. You can remember that already. What happens? Everything goes up. Okay? Everything goes up. Problema mo kanina na hypotension? Wala nang problema because there is your sympathetic nervous activity. Next, you have also your retention of your water. Ayan o. You lack water, correct? Therefore, your angiotensin 2 will allow the retention of water and not allow excretion of your water out into your urine, okay? Because there is your retention of water. Next, aldosterone secretion. Your aldosterone secretion will allow your water and salt retention. Wherever salt is, water follows. Anong problema kanina? Kulang ng blood volume. So, therefore, kapag mas marami kang solid such as your salt being retained inside your system, therefore, water will not go out but it will follow and be retained inside your body. Okay? Next, you also have your arteriolar, sandali, nawawala na naman ako. Ayan. Arteriolar vasoconstriction. The problem earlier was about your hypotension, correct? Now, because there is your drop of your blood pressure, ano dapat ang kailangan gawin ng intravascular compartment mo? Si intravascular compartment will need to constrict. So, if there is constriction of your intravascular compartment, therefore, blood pressure will also rise up. So, did we correct with our problem earlier about hypotension? Yes, we did. And then same, because there is your angiotensin 2, it will release your ADH. Saan na yun? Wait lang. Where are you? Ayan. I cannot see. But this is your ADH secretion. What is ADH, guys? Can you remember? Anatomy physiology.
Antidiuretic hormone.
Yes. Your antidiuretic hormone, from the word itself, anti-diuresis. Ano ibig sabihin ng diuresis? What is diuresis, guys?
Sweating.
Not necessarily. That's diaphoresis, not. Okay, diaphoresis is different, ha? Diuresis is, what is diuresis?
Production of urine.
Too much body fluid.
Okay, diuresis basically is yung pag-ihi. Okay, so when you micturate, when you urinate, the production of your urine in itself is diuresis. And, you know, your problem earlier is about having less blood volume. Because you have less blood volume, anong nangyari saan? Okay, kapag you continue to have diuresis and you have less blood volume, that's double jeopardy. That's bad and becoming to worse. So therefore, what the body is going to do as a part of your renin-angiotensin-aldosterone system is to stop your water from going out because you need water. Okay? Therefore, you have your antidiuretic secretion. Okay? So, because there is your antidiuretic hormone that is secreted, it will not allow diuresis to happen and it will allow water to be retained inside your body. Understood, guys? Okay? So, that is basically your RAAS as a fluid and electrolyte equalizer. Okay? Ganyan lang kadali ang RAAS. So, let's go back. Ayan, masyadong na-explain ko naman na yan, diba? Okay. So, And then I've mentioned also, so we have your RAS already, and then I have also mentioned your antidiuretic hormone already, and then you have your atrial natriuretic factor. Okay, atrial natriuretic factor is a hormone from the heart muscle which is responding to fluid excess. Now, this one, okay, causes increased urine output. Siya yung nagsasabi sa kidney, hoy, dapat kang umihi. Kasi masyadong maraming laman yung puso mo. Okay? Remember your pericardial fluid, guys. Okay? This is basically for your heart. Heart lang siya. Okay? So, because there's so much fluid in your heart, okay, in your pericardial fluid in your heart, okay, now your atrial natriuretic factor is going to tell your brain, which the brain will relate to your kidney, to have an increased urine output. Therefore, will this increased urine output help the decrease of your fluid inside your heart? Yes, it does. Not so much, I mean, not maximally, but minimally. Okay? Because there's still other mechanisms that's going to happen with your RAS, also with your antidiuretic hormone, etc., etc. So these are the hormones or the mechanism to regulate your homeostasis. So again, nabasa ko, ay na-mention ko naman. So when you have your thirst, obviously, if you're thirsty, you drink. These are triggered by what? You have decreased salivation, you have your dry mouth, you have your increased osmotic pressure, okay? Or there is decreased blood volume. These are, you know, your mga red flags. Sabi ni brain na, oy, kulang ka na ng water, minom ka. Ganyan yon, okay? Negative feedback mechanisms. Again, I've mentioned already, your brain tells you to drink, you drink, okay? Huwag matigas ang ulo. Pag sinabing drink, hindi po soft drinks, hindi coffee. It's water, guys. Okay, there's much difference. When you have your isotonic, remember isotonic? And then you have your hypertonic solution. Will it help? Okay. Next, I've mentioned your RAS. Okay, this is your RAS, guys. So renin-angiotensin, this is basically what I have explained earlier in our diagram. Okay. Yeah. So this is your diagram. And then you have your ADH. So your ADH is produced in your hypothalamus and is released in your posterior pituitary gland. And then tells your hypothalamus, hoy, ano ka ba? Dapat huwag kang maglabas ng water kasi nga kailangan mo ng mas maraming tubig. Okay? So that is your antidiuretic hormone. And then you also have your aldosterone. I've mentioned that it promotes sodium and water reabsorption. Whenever there is your absorption of your salt, water also follows. Okay, water also follows. Okay, so I hope I'm pretty clear with what I have discussed earlier. Okay, now let's go on to your sensible and insensible fluid loss. Okay, sensible, ibig sabihin nun, expected siya. Okay, because if you drink something, then you urinate. Okay, and if you eat something, some of the fluids is going to be in your feces. Okay, and then also, you also have your problems in your vomiting. Whatever is taken in is also going to be vomited out. That's your sensible. Kasi masyadong, how do you call this one? It's very observable. I mean, when you look at it, talagang you are going to expect na, fluid ang problem dyan. Okay, that's why you call it sensible fluid loss, because the manifestations are evident that yes, there is your fluid loss. Okay, and then we have what we call your insensible fluid loss, yung tipong maliliit lang. Okay, in very minimal scenarios, but when you have more than enough of the scenarios ongoing, then you can have your a lot of fluid loss that's happening. Now, if you're going to look at the picture below, you have your normal fluid intake and loss. Okay? Obviously, hindi pwedeng intake ka lang ng intake. Kung saan naman yan, magmumukha kang mojako, di ba? So, obviously, you cannot have just intake and intake. There should be balance. From the word homeostasis again, whatever you have taken in, some of them must be taken out. So, look at that picture below. You have normal fluid intake and loss in an adult. So, you have intake water in food. Yes, there is water in food. That's around 1 liter, okay, or 1,000 ml, or 1,000 cc. And then you have water from oxidation. Whatever you have inhaled, okay, whatever you have inhaled, oxygen has water there, okay. There is also water there, or it needs to have water so that it's going to be absorbed appropriately by the body. So water from oxidation, okay, has 300 ml, and water in the liquid in itself is around 1,200 ml. 8 to 10 glasses of water. Okay, 1,200 ml. So the total of that is basically around 2.5 liters or 2,500 ml. Okay, now we also have, again, on the flip side of your intake is your output. So, yung in-intake mo, meron siyang paglalabasan. Now, you have your skin. Sabi kanina ng diuresis, diaphoresis yun okay? But that's abnormal. Technically, when for the normal scenario, your skin actually excretes out fluid at around 500 ml. Mas lalo, if you're going to look at it, it's more than that, abnormally more than that. If we have very, very hot and humid environment, like for example, it's summertime, diba? You sweat too much. That's when your diaphoresis happens, and that means a red flag. You have to do something about that because you might be dehydrated because you have lost so much of the fluid. Okay. Next, you have the lungs. Yes, you have water in oxidation, but you also inhale out your water from the lungs. You have your lungs output from around 300 ml, okay? And then you also have your feces kasi nga nilabas mo, you have around 150 ml. That's why when you if you like to quantify your feces is not possible, timbang mo lang siya. Timbang mo yung diaper, right? When you do your quantification of ml of your feces, you try to place it in a diaper and then you weigh it. Then you try to check how many kilograms, how many ml is going to be affected or is going to be inside that feces. And then naturally you also have your kidneys because yes, the major sensible fluid loss there is your kidneys through your urination. That's around 1,500 ml. Okay? So total actually is 2,500 ml. Okay? So 2,500 for your intake and 2,500 for your output. Look at here. Sometimes it varies depending on the references, but basically it's within this range. So you have your gains, you have 2.5, ayan no? And look at the picture in this part. You have your gains, you have your losses. So 2.5 ml per day, 2.5 ml per day for the losses and the gains. Metabolic water, you have your food and then you drink. And then you have your feces, your expired air, you have your cutaneous transpiration, your sweat, yes, and then you have your urine. So these are basically your sensible and insensible fluid loss. So please take a picture of this one if you have screen capture there, or you can just write in your notebooks. Next, this one. So we have your types of your fluids according to composition. Ito yung sinasabi ko kanina, di ba earlier I was asking, what is the color of your 0.9 sodium chloride? Tapos may nagsabi, pink, blue, light blue, violet. No, this is, okay, this is your sodium chloride. See, it's green in color. Clients who have dehydration or clients who have problems with your fluid deficit need to have your sodium chloride. Okay? Usually, the doctor is going to order fast drip. Fast drip mo yun kasi the client lacks fluid. It's the easiest one to provide to your patient who is suffering from dehydration and who is suffering from hypotension or even suffering from shock. Kaya dapat magbigay ka kaagad ng sodium chloride. And again, it's safe because it has the same, even if you do fast drip of 1 liter, it's fine. It's fine, especially if you have your dehydration. Because this is safe, has the same component or solution and concentration of your solute as that of your blood plasma. Okay, so we have your plain NSS. Okay? Yes. Okay, next, you have your, ito yung mga plain LR. Plain and lactated Ringer solution. Plain, such as this one. Yes. That's your plain LR. It's different when we say D5LR. When we say D5LR, may D na siya, may dextrose siya, may glucose siya. Okay? A D5LRS solution has dextrose and that has glucose in it. And that means that has your solutes in it. Okay? Solutes in it. So, if that is the case, you are going to expect that your D5LRS will be around here. There you go. Ayan o. D5LR. See, if you're going to look at your hypertonic solution, there's D. Ayan. D5. Okay, I mean D50, D50-50. Who among you has seen a D50-50? Maliit lang siya, para siyang sterile water, and then the color is red. Was this discussed in your pharmacology? I mean, the type of fluids, guys? Are you still there with me? Your D50-50. I'm talking about the D50-50. D50-50. Guys, okay pa ba kayo? Are you still fine there? Parang kulang ata yung oras natin. Guys, please answer my question. Have you seen a D50-50?
No, ma'am.
Not yet. Hindi pa. Okay. Okay. Now, ganito kasi, when you have your D, okay, that means dextrose. And it tells you the amount of your glucose or your solutes that is dissolved in that particular solution. Now, in this case here, if you're going to talk about D5 LRS, it means to say 5% of your glucose is dissolved in your lactated drinker solution. And then versus, we have your plain LRS. This is plain, okay? This is plain. Ayan. So, therefore, there's not much solution in this. There's not much solutes in the solution. That's why it's also under your isotonic kasi wala masyado. Okay? But, when you have your D5, lahat ng D5, let's go to your hypertonic. Ayan, ito yung hypertonic natin. Lahat ng mga yan, D50, you have D10, you have D5 NSS, D5 LRS, 3% NSS. Why? Because that's 3% of your sodium and your chloride. That's a lot of your solutes. And again, we have to remember, hypertonic, maraming solutes doon sa solution. There's a lot of solutes in the solutions. Okay? So, this is your hypertonic solution. And then your hypotonic solution, it's just a little bit of your solutes and more of your solution. Okay? So, that's D5, water. But that's water, guys. Okay? Not your lactated drinker solution. And then, you have your 0.3 and then your 0.2. Hypotonic in itself, D5 water, sabi nila, isotonic siya. Because there are some books I have read that they consider your D5 water as isotonic. But that's not the case. It's just isotonic when it's just in the bag. Okay? When it's just in this compartment. Pag nandiyan lang isotonic. But once it is infused into your system, there is your quick metabolization of your D there, of your dextrose. Okay? Pero, compared to your hypertonic, mas marami yung solvent natin. Okay? There's a lot of more solvent compared to your hypertonic solution. Okay? So, that is your D5 water. So, these are the types of fluid and compositions of fluid that you need to remember when you are giving your IV fluids to your patient. Again, if you have a client who is suffering from dehydration, it's expected that the doctor is going to order an isotonic solution as a fast drip. Okay, especially if you're dehydration, and this is the proper fluid to give to your client. Okay? Next. So, paano naman? We have problems with your dehydration. Kulang pa rin eh. It's not going to be enough. Okay? Your client is suffering from, continuous continuous fluid loss. So, aside from your IV solutions, which are termed as, by the way, go back to, all of these IV solutions, are examples of what we call your crystalloids. Crystalloid fluids. Okay? Crystalloid fluids. Okay? The crystals because there's a little bit of your solutes mixed with your solutions there. So, crystalloid fluids. Okay? And then, since kulang pa din, even if you give your fluids, you have your Q6, you have your Q4, or even you have your you have your fast drip, it's still not going to be enough. How are you going to help your client increase your blood pressure, increase your fluids? The client is suffering from dehydration and that's a big no-no. So what are you going to do? You're going to expect that the doctor is also going to order your colloids. Remember your colloids, guys? Remember, you need to have oncotic pressure so that your fluid is going to come back inside your intravascular compartments. So in this particular scenario, another management for your patient, especially if the client is suffering from fluid volume deficit, is to provide your colloids or your plasma expanders. Again, earlier we were discussing about fluids, which intravenous fluids, which are examples of crystalloids. Okay, this time around, what you see in this slide is basically your colloids. Your colloids, as usually your protein, CHON is protein. So, example of this are your dextran, your HETA starch. Okay, these are usually your plasma expanders, which has your protein component, which allows an increase, okay, an increase of your colloid oncotic pressure so that more fluids will be maintained inside your intravascular compartment and not go outside of your intravascular compartment. So you have your dextran and you have your HETA starch, okay? Now, how are they different from each other, okay? Your colloids versus your crystalloids. Again, crystalloids, ano ba yung mga yan? It's your IV solution. Ayan, no? This is your IV solutions. Okay? Crystals kasi, I'd like to think that the crystals there are the glucose and the solutes that's included in your solutions. But when you have your colloids, we have your protein component there. Wherein, if you're going to look at what's posted in this slide, you have larger particle because protein is a large molecule compared to just your crystalloids kung saan you're a little bit smaller in nature. Okay, and you have your heterogeneous system because it follows your protein composition, while true solution because it just has your solvent and your solutes. Okay, permeability is comparatively low kasi it will not allow the leaking out. Okay, because it would like to be maintained inside. Okay? There are instances where in the crystalloids, even if you provide, but because there is still a low oncotic pressure, permeability is high. So, kahit na meron kang crystalloids na binibigay, even if you provide or infuse crystalloids, such as your IV fluids, even if you infuse IV fluids inside your, infuse to your patient, but the oncotic pressure is very low, there is a high permeability, there is a high possibility of the fluids to still leak out into your interstitial spaces. Because, by nature, crystalloids are highly permeable. Understood? Okay? Next, you have your lyophilic and your lyophobic, hypertonic, don't mind this one, it's not too important. Let's move here. Okay? Here, ito dapat. Yan. Colloids, again, are always about proteins. Now, it can come in the form of your milk, shampoo, gemstones, etc., etc. Okay? If you're going to have a picture of what your colloid versus a crystalloid looks like, okay, in normal scenarios, you can have this one. Yan. Colloid. Yan. Colloid. Milk mixed with water. Kasi milk is protein in itself, right? So, obvious talaga that this is a colloid because it has protein in it. Now, look at your crystalloids. I've mentioned that the crystals there are like your your molecules or the solutes that are dissolved in your water. So a classic example is your salt dissolved in water. So that is a crystalloid. These two pictures are a classic example of colloid and crystalloid in everyday normal scenario. But if you're going to be assigned in the hospital, okay, this one, okay, is a colloid. Why? Because it is a human albumin. Okay? Human albumin. Human albumin that is used as a plasma expander so that it will elevate your blood, your fluid volume. Okay? It will actually expand your plasma and that it will increase the number, it will increase your blood pressure and it will also increase your composition of your fluids. Okay, so from the word albumin, albumin is a smaller molecule of your protein. Okay, again, balik tayo. Colloid is equals to protein is equals to albumin. Understood? Okay, next, we have here, this is your crystalloid. A classic example of a crystalloid is your IV fluids. Again, look at your representation on the left side. The soap dissolved in water. A crystalloid is an example, very much seen in the hospital are your IV fluids, intravenous fluids. So, am I clear with my explanation with this one? Okay? So, okay. Ito na, sinasabi ko, composition of fluids. Ano ang meron sa saline solution? What are inside, or the solutes that are in your saline solution? Plain NSS is a saline solution. Okay? Your 0.9 sodium chloride. Kaya nga sabi nila, plain NSS or 0.9 sodium chloride is basically your saline solution. Where am I? Where is my okay. I'm always lost with my mouth. Okay, so we have your water, your sodium, and your chloride. Next, your dextrose solution. Okay, dextrose sugar. Okay, dextrose. This is your, I'm lost again. This is your dextrose solution. Okay, so we have here your water plus your calories, which is basically your sugar. Okay, next, you have your lactated liquid solution, which has more electrolytes. Ngayon, if the client is suffering from electrolyte imbalance, okay, this is a more appropriate one that is going to be given to your patient, okay, because your lactated ringer solution has water, has sodium, has chloride, has potassium, has calcium, and your lactate. So that's why after maintaining or stabilizing your client who is suffering from your dehydration, that you are going to expect that the doctor might shift that NSS to your lactated ringer solution. Kasi mas maraming electrolytes daw. It also is dependent on the type of electrolyte imbalance that the client is suffering. Okay? So we have here your water, your sodium, your chloride, your potassium, your calcium, etc., etc. Usually this is the go-to intravenous fluid that is inserted to clients with no problems in fluid and electrolyte imbalances. Once you are once you are admitted in the hospital, this is usually the lactated ringer solution that is given. Okay? Next is you have your plasma expanders. I have mentioned, paulit-ulit na lang, albumin is also a protein derivative, or dextran is an example of that plasma expander and plasma proteins. Again, your oncotic pressure pulls fluid back into your intravascular compartment in your circulation. Okay, and then we have other fluids such as your alimentation. Ito yung mga parenteral nutrition. Okay, your parenteral nutrition. Usually, this is given with complete mix of your fluid, your electrolytes, your amino acids, your calories. Okay, especially if the client is on NPO. So we have what we call your total parenteral nutrition. It's your TPN. With it's actually your food translated into IV fluid. That IV fluid already has everything, even your calories, even your lipids, even your amino acids, even your fluids, even your electrolytes. So that is your total parenteral nutrition. We call it your TPN. Okay, total parenteral nutrition. We are, as nurses, we are anticipating that this is given to clients who are unable to eat. Okay, who are unable to eat, who are having muscle wasting. Remember, when you have muscle wasting, you lose a lot of proteins. Therefore, you provide your TPN. Those people who are unable to take it orally, or those patients who are having your gastrostomy, you know, they have your NGT feeding, or they have your gastrostomy feeding through their abdomen. That's where we provide your TPN. That is your composition of your fluids. Okay? Am I clear with this discussion, guys? That ends our discussion. Okay? I'll give you 10 minutes sayang yung, I'm going to try my best to record the the next topic, which is about fluid imbalances. Kasi I think it needs to be, it needs to be explained properly. So, wish me luck for my internet connection, so because it's going to be a very big file if it's going to be a video. But then again, we have ended our discussion about your principles of your fluids in it by mechanism also. And then I'm going to give you 10 minutes break, so that after that we are going to have our recitation. Okay? We have 9:30, 10:30, 11:30, 12:30. Our class ends at 12:30. Okay? Okay. Okay, but guys, what time is it in your watches now?
11:40.
11:40. So I'll give you 10 minutes, and then we're going to have the recitation, and then you can have your lunch. Okay? I hope I am pretty clear. Okay? If you have questions, you can do that later on when we're going to have our recitation. I'll give you 10 minutes, and then we will be back. Okay? In the same Google Meet. Everybody must be online, because pag natawag ang pangalan mo, if I call your name and you're not around, you lose 10 points for the recitation. Okay?
Yes, ma'am.
Okay, am I clear, guys?
Okay, ma'am.
Okay. I'll give you 10 minutes.
Okay po.
Let's end. Bye, guys.